She got admitted to the hospital. I took her to the operating room, cleaned out her wound, and she ended up having a really long hospital stay. And we're afraid that she's gonna die. Plastic surgery has become a very popular trend amongst modern women and men as well. Despite that, there is still this gray area. People are uneducated. They really don't know some things. There's this large gray area. And so people are traveling abroad to get surgery. And so today, what I want to do is give you the dirty truth about medical tours. You have plastic surgery. There are a lot of people out here who aren't even plastic surgeons. So you have plastic surgeons doing plastic surgery. You have other type of doctors doing plastic surgery. And then you have people who aren't even doctors doing plastic surgery. So you, as a layman, as a user, as an audience, as a potential patient, you need to know what you are getting. Because if you end up going to someone who's not certified or who's not a plastic surgeon, they may be able to do your surgery and you may have a great result. But what about those patients who have problems, who have complications? So I am a board certified plastic surgeon, and part of being a board certified plastic surgeon requires you to have operating or admitting privileges to a hospital. So basically what that means is if you come to Dr.Jones, MD, plastic surgeon, and you have surgery, and God forbid you have a complication, and it requires admittance to a hospital, I can take you to a hospital and say, hey, we're going to this hospital, we're going to admit you, we're going to evaluate you, give you IV antibiotics, whatever it is, whatever it may take, we have to operate on you, we'll take you to the operating room in the hospital. That's what will happen. But let's say you go to Joe Smoke, who is an internal medicine doctor, or he's a doctor but he didn't finish a residency. He does your liposuction and you have a complication. You end up in an emergency room. ER doctor sees you, evaluates you, says, hey, you need to be admitted. They're not going to be able to call Joe Smoke because Joe Smoke is not a plastic surgeon. Joe Smoke does not have admitting privileges to a hospital. So now I just so happen to be on call that night. They're calling me and I have to come and see you. Problem. Why is it a problem? Because I didn't do your initial operation. I'll care for you, but there are some plastic surgeons, there are some other doctors out there, they're not going to give you that same type of quality, that same type of energy, because you're not technically their patient. They are just fulfilling their obligation as a member or staff member of that hospital. And not only that, they don't know what you had done. There's a fear of litigation. And so they're just coming in, they're just trying to stabilize you. And so you just run into a lot of problems. So that's one big problem. Patients who come into my office who've had complications is usually patients who have gone to other countries. Like, it's called medical tourism. So basically what happens, people are going to like Dominican Republic, they're getting Brazilian butt lifts, they're getting lipo 360, they're getting breast augs, they get breast augs with a lift. They're just getting, full mommy makeovers, and that's great. They're going, and the reason people are going is because they find that it's cheaper. In my mind, I really don't think it's that cheaper because you have to pay for the surgery, then you have to pay for your flight and your accommodations, and then you got to pay for someone to take care of you after. And so the cost, I don't really think is worth it because you're jeopardizing your health, you're jeopardizing your life, you're jeopardizing your safety. Here in America, there is a standard of care, and if you go to a qualified individual, that standard of care should be met. I'm not saying that they don't have great plastic surgeons in other countries, but my biggest concern is what is going to happen in the event that you have a problem. Whether it's a minor problem or a big problem, what are you going to do? You have your surgery in Colombia, what are you gonna fly back? You just gonna get up and fly back to Colombia and go get your revision done? If there's something more acute, let's say you need a blood transfusion, what are you gonna do? Can't do anything. I'll give you a perfect example without saying any names. I was called from a friend, and she was like, "Hey doc, my friend is in Dominican Republic. She had a really bad complication, and she's in an intensive care unit, and we're afraid that she's gonna die." And so, first thing, I don't really speak Spanish, so I need a translator. So eventually I was able to speak to the doctor, explain to me what was going on. Patient had a perforation of their bowel. Basically, when you're doing liposuction, I'm not saying I don't know exactly what happened, but when you're doing liposuction, sometimes what can happen is if you're not careful, uh, the cannula could penetrate the abdominal wall, and then the cannula go into your abdomen, perforate some of your intestines. Your intestines are leaking. You're in a complication. You got to open up your abdomen. It's called exploratory laparotomy. Open up things, find out where the damage is, repair it. And if that happens, there's a chance that they may not be able to close you because there's all this contaminated stuff inside your guts. So you end up in the ICU, critical condition, IV antibiotics, ventilator, and then once you're stable, you're left with an open belly because there's so much swelling. And so she ended up coming to me, and I ended up taking her to the operating room. She was transported via helicopter. But here is the catch. There had to be an accepting physician who has privileges at a hospital. So if you're not a board certified physician, you cannot accept a patient. Like, you have no privileges. So I, just off the strength of my relationship with this person, I said, you know what, yes, I'll take care of her. So she got admitted to the hospital. I took her to the operating room, cleaned out her wound, and she ended up having a really long hospital stay because it took time for the wound, the swelling to go away, and it took a while for it to become safe for her to have her incision closed. Now, does she look like she wanted to look? Absolutely not. But she's alive and she's able to talk about it. So basically what I'm saying is there's a lot of perpetrators out here, and you have to do your own research. Unfortunately, there's nothing out here that's really protecting you as a consumer. You have to know what you need to know. You need to know about your surgeon. You need to know their results. You need to know where they operate. You need to know if they have privileges or not. You need to know whether they're board certified or not. All these things you have to figure out yourself, because there's no one place where you can go and say, oh, this is, he is or she is who she said she is. All right, I want to thank you all for tuning in and listening in. And I just want to make sure we all understand this is by no means an effort to discredit another physician, doctor, provider. It's really just to educate you so that you're not misinformed, so that you can make the best possible decision for yourself as a consumer. And so if you truly are considering or thinking about plastic surgery, watch this video next.